Our planet, it keeps on spinning, but there are a lot of issues going on right now, aren't there? There is inflation, there is Ukraine, there is the abortion debate. Well, the country is bracing for another issue too, this time involving health care.
Some health insurance experts are sounding the alarm that health insurance rates for some will hike dramatically this fall. Congress knows there's a looming problem, but so far, no action's been taken.
Remember the Affordable Care Act and how it created new health insurance options for those who don't have insurance? Well, when President Biden signed the American Rescue Plan into law during the height of the pandemic, it created what's known as advanced premium tax credits that made health insurance plans obtained through the government marketplace cheaper. The average family saved $200 a month in premiums. 4 out of 5 consumers were eligible for plans that cost just $10 a month. Enrollment has been up 21% this year in the program, with lower prices being a big factor. However, the funding that made the plan so cheap is set to expire at the end of this year, with families set to receive notices just a few weeks before Election Day. Some plans may go up by hundreds of dollars each month. More than a dozen Democratic governors wrote to members of Congress last week asking them to take action to prevent what they call, quote, dramatic premium increases soon. There are concerns in states like California, Colorado, Michigan, and Nevada that this could lead to Americans declining health insurance next year. So far, though, it's unclear whether Congress will address this. Republicans have been reluctant to extend any type of pandemic assistance over concerns that will fuel inflation. Democrats, meanwhile, are hopeful a solution could be included in a reconciliation package this summer that would only pass with Democratic votes in the Senate. However, recent history has shown us in this Congress, getting every Democrat on board to pass something can be difficult. In Washington, I'm Joe St. George.
I'm Vanessa Mishania. Imagine if every time you had to go to the doctor or wanted to sign up for insurance, you'd be putting your family at risk. Well, that's a very real situation for many people in our country of Hispanic descent, whether they are undocumented or if they are U.S. citizens. Well, a few bills were just signed into law here in Colorado that's meant to help people in those situations, and community advocates hope other states will follow suit. Odalis Avila's job is finding answers.
I do have a lot of clients who are undocumented.
Answers for families who are used to being told no.
When you're undocumented, they don't qualify for anything.
Odalis works at Servicios de la Raza, a social services organization that helps Denver, Colorado's Latino community navigate different health systems.
We do have families where maybe the parents are undocumented, but their children are citizens who fear, if we apply, for our kids, how is that going to, affect me?
She sees firsthand how that uncertainty turns into real health complications.
Yeah, it's hard. A lot of the time it is upsetting to see.
According to 2020 U.S. Census data, the Hispanic population is the least insured in the country. 18% of Hispanic people of all ages in America were uninsured, compared to 10% of Black Americans and 8% of white Americans. By age groups, 25% of working-age Hispanics and 9.5% of Hispanics under 18 were uninsured.
Do I get health care for my child who needs a transplant? Or do I make sure that we can stay in the United States and not go back somewhere that we had to flee because of violence?
Raina Hutledge is the senior policy manager at Colorado's Center for Health Progress, an organization that helped pass laws that allows health insurance access to undocumented immigrants as well as low-income people.
The Affordable Care Act was passed. Concessions were made to get it to pass. And some of those concessions were things like leaving out DACA recipients, leaving out undocumented immigrants.
A new Colorado law will expand Medicaid and CHIP coverage to undocumented pregnant people and children in 2025. And beginning next year, state funds will be available to help qualifying residents who are at a certain level below the federal poverty line purchase insurance. Several states like California, New Jersey, Texas, Michigan, and New York have already worked to create similar solutions. For Odalis, she hopes that the more access increases for low-income or undocumented folks across the board, the more people will feel comfortable signing up and not sacrificing their health.
I hope that they support future laws that are possibly put in place. I hope they support for this law and this program to be expanded.
I'm Vanessa Mishania.
Everyone needs a hug sometimes.
Using the art of song to treat long COVID. Next on The Race.